drop off, meetings from 10 to 3, take kids to soccer, then no time left for a jog.
When everyone else is relying on you, it's easy to put your needs last. BetterHelp connects you with a licensed therapist online, so you can show up for yourself the way you do for others. Visit BetterHelp.com/positive to get 10% off your first month. That's BetterHelp.com/positive.
You know, a lot of people, especially celebrities, have been using Ozempic to lose weight quickly.
That's a drug that is meant to treat type 2 diabetes, but doctors are finding it can have some nasty side effects that are sending some people to the ER. Dr. Thaïs Aliabadi is a board-certified celebrity OB/GYN in Beverly Hills and is also a medical weight loss expert. Doctor, thanks for being with us.
Thank you for having me.
So let's talk about, we've done a number of programs in the past on the benefits, for some people anyway, of using Ozempic and losing weight. But we are reading about more reports of people who have had unpleasant side effects, perhaps ones that they were not anticipating. What do you see in your own practice?
So I've been using some form of these medications for actually about 10 years. There's nothing new about this group of medication. Ozempic became the poster child of this group of medications when a lot of people started publicizing it on social media. So these medications are not necessarily new. Ozempic is a semaglutide. Semaglutides come under many different names. Ozempic is indicated for diabetes, but a very identical medication named Wegovy is used for weight loss. So a lot of doctors are using Ozempic off-label for weight loss. I've used these on my polycystic ovarian syndrome patients, which is a hormonal imbalance that 15% of women suffer from. For many, many years, I've used these medications, and I was reading this article you sent me, and I personally have not seen so many complications. I think a lot of doctors are just starting to use it. They're not familiar on how to use these medications, who to prescribe it to, at what dose to start it, when to go up. And I think that's when, some of these side effects might show up. I treat patients on a daily basis. I've done it for 10 years, and I've never seen some of these complications that have been listed.
What are some of the nasty side effects that you've heard about?
I mean, the ones that I've read about are pancreatitis, thyroid cancer. What I see are sometimes bad nausea and vomiting, but I know immediately how to fix it. It's not something we cannot fix. Some in my male patients, they suffer from burping, but most of my patients in my practice, I'm an OB/GYN, they complain of nausea, but I know how to dose it. I know how to slowly go up. I know when to stop it, when to switch them to a different medication. So it comes with experience. And I feel like, I have plastic surgeons calling me and asking me how to dose an Ozempic. So I think those are the patients that are getting in trouble. If you are supervised by a board certified physician who's done this for many years, the risk of complications are minimal. I honestly can't think of, maybe I've had a handful of patients in 10 years that I've sent to the ER. So it's not like these patients are ending up in the ER. It's false information.
How does somebody know that their doctor is qualified to give this drug, which is off-label use at the moment, right, for weight loss?
So Ozempic is off-label. Wegovy is not. Saxenda is not. There are a lot of medications out there that patients can be on for weight loss. You can ask your doctor, how long have you been prescribing these medications? And, it's hard to say. One thing I will tell you, I have tons and tons of patients show up to my office and they say, my doctor gave me Ozempic. And I'm like, well, can I see it? And when they bring it or they send me a picture of it, it's the compounding form. These compounding Ozempics or semaglutides are not FDA approved. They are mixed. We don't know where the raw material are coming from, which lab is mixing it, how much these people are pulling in a syringe. When I prescribe Ozempic, it's a pre-filled pen. The risk of making a mistake with the dosage is almost zero.
So wait, but hold on a second. So are you saying that you see patients who have other physicians, I presume here in the LA area, or mostly in the LA area, and when they come to you and they show you what they say, here, my doctor gave me Ozempic, you look at it and it's not really Ozempic? Is that what you're saying?
Oh, all the time, all day long. And patients are shocked when I say it. Let me tell you, there's a shortage of semaglutides right now in this country because diabetics use it. I've used it. My mom's been on this stuff for 11 years. So none of this stuff is new. I've been using it for weight loss for 10 years. And honestly, I think it blew up in this town because of me and my patients. But as long as you do it right, you give prescribed FDA medications and, it's supervised under an experienced physician, you will not have these dangerous side effects that people talk about. Let me tell you, as a physician and as a woman's advocate, I really get upset when I see so much negative advertisement against Ozempic or any of these semaglutides. These medications have been life-changing for my patients. It's been a game changer for obese patients, for my PCOS patients. It breaks my heart when doctors with very little knowledge about these medications go on these platforms and start talking about all the scary things that could possibly happen. Have you ever read the backside of an Advil bottle? Imagine if you advertise GI bleed, this, that, kidney failure, no one would take it. But those are extremely rare side effects. I'm telling you, I've used this stuff in some form. I started using Trulicity off-label for my sick patients, PCOS patients, obese patients 10 years ago. And for 10 years, I've used these medications. And that's why I finally started Trimly, because I've had an influx of people coming to my office for weight loss. And I'm an OBGYN. I treat women for all sorts of health issues, but weight was one of them. And I started Trimly so I can help a larger group of patients and help them lose weight and help them diagnose PCOS. But to just go on these, to see these articles with all these negative comments about it, it's really heartbreaking because, like I said, it's been a game changer for these obese patients.
All right. Dr. Thaïs Aliabadi is a board-certified celebrity OBGYN in Beverly Hills. I guess, Charles, the takeaway is if a doctor prescribes Ozempic to you for weight loss, check around and make sure that it's really Ozempic and not the compounding form.
But a lot of that's easier said than done. A lot of patients are very reluctant to question a physician because physicians are kind of authority figures, and they figure if the person, the guy or the woman with the diplomas on the wall, are saying that this is okay to take, a lot of people will not question that.
And getting a second opinion is easy to say, but it's a little more difficult to do in practice.
What you watch depends on what kind of mood you're in. Sometimes you're craving comedies like Friends or South Park, and sometimes you're more into dramas like HBO's Succession and House of the Dragon. There's also cooking shows like Chopped and Beat Bobby Flay, and even movies like The Lord of the Rings and Shazam! Fury of the Gods. Well, Max is the streaming destination that has the best of entertainment for whatever mood you're in anytime. And plans start at as little as $9.99 a month. Max, the one to watch. Subscription required. Visit max.com.
Get moving in the most electrifying Honda vehicles yet, like the CR-V and Accord, with available hybrid powertrains designed for more responsive performance. Honda, the 2022 Kelley Blue Book's KBB.com Best Value brand. Make a move and find the Honda CR-V Hybrid or Accord Hybrid for you.
So see your North Georgia Honda dealer today. Honda gets Georgia.
See dealer for financing details based on 2022 brand image awards from Kelley Blue Book. Visit KBB.com for more information.